Okay, this is Dr. Samira Khan. Many of you knows me already. I have been conducting MRCPI, OSCE courses, and MRCOG Part 2 and Part 3 courses. So this course, which I'm going to announce, this is the introduction of this course and introduction of the exam itself. It will be in February 2023. So there will be 3 exams in 2023. First one in Feb, the second one in May, and the third is in November. There are, in this November 2022, many of you entered the exam and you have an idea how the exam is. And it was, although recalls are coming, but the exam was not that easy. So in order for you to understand how the exam is and how I'm going to deliver the course, so it's important that we will. I'll give you some introduction about it. If any of you want to open their video, their camera, they can open. For me, I will open because if once we will discuss the scenarios, I think eye-to-eye communication is also important. So let me open the camera, and if any one of you want to open, they can open also. So let me show you the poster, how it's going to be. So we start now, and every weekend we are going to do one session, and before the exam, it will be more intense. Like it will be like twice per week. So it will be module wise. This is the schedule what we will follow, but it can be changed. I mean, according to your advice. Maybe I just like to finish like obstetric first, and then go to gynae, all kinds of gynae, and then at the end we'll have the mock exam before the real exam. So the plan will be like, it's going to be like 3 to 4 hour session. And I will provide you with all the material, the pre-course material, that from where to read for this particular module. And then the source of information will be provided also, and we will go module wise. The exam is mostly from recalls. So our goal is to finish almost all the recalls, and at least the type of questions that, to cover some particular type of stations that always comes in the exam, that usually comes in exam here. So I'm going to tell you about, there are some difficult stations, and it might happen that some strange stations will come in the exam, but there is a way to deal with them. If this is the first time you are seeing this station, then do not panic. You can do it, and you can even pass the station even if you don't know anything about this topic. So I'll tell you it is possible to pass in first attempt. It is possible. So there are many people who pass in first attempt, and if you are prepared well from the beginning, and you go systematically, and your goal is to pass the exam, not to do the experiment, then you will do everything, and you arrange yourself to pass in first attempt, and you can do it because many people are able to do it. So I have one more student here. Is this Dr. Sarah?
Yes, Dr. Samira. Hi, how are you?
Hello, how are you? One of my dear old student, Dr. Thiel, do you know Dr. Sarah?
Yes, I know. Yes. How are you, Sarah?
Doctora, how are you?
Dr. Thiel
Yes,
is with
I'm
us.
fine.
Congratulations, you passed part 2. Nice.
Yes,
Yeah.
thank you.
You deserve it. You deserve it.
Are you preparing for February exam, Sarah?
Don't tell us it.
I was about to ask the same question. So either you appear in Feb or you appear in May. It doesn't matter at all. You have to start from now. So this is
This is the last chance for the online exam, Dr. Samira, as I hear.
It is. I checked their website. It is not written on their website. There are many people talking about it, but I just checked all their website. I have not seen written anywhere. Have you seen
Okay.
written anywhere?
No, I did not.
Yeah, okay. Whatever, you have to be ready. Either it is online or in person, but the most important thing for you is to be ready. So you concentrate on your part, what you have to do. So I was just showing them that what we are going to do in the course, and this is the schedule that we will follow. Some of the plan of the course, that how it will be and how you should do it also. So until you pass your exam, you can my old candidates, my old students, they know that I don't restrict the students, so they can attend. If I'm doing part 2, they can join, and vice versa also. And anything, like if they want to participate next time, and as listeners, they can participate also without like paying for it. So I don't like mind. So and you are with me 24 hours on WhatsApp and on Telegram also. So they know also, my students, that they are with me all the time. You have to find a study partner. So how many of you have a study partner? I mean, this is very critical. All of you have study partners?
No, doctor, I don't have.
And what about you, Sarah?
No, doctor, I don't have.
Anam is not going for this exam, so it's okay. And what about Manikam, Dr. Manikam? Do you have a study
Ma'am,
partner?
I had initially, ma'am, one Gayatri was there with me, but she joined one course, so I lost her. Then I have to.
Yeah,
work.
but initially you had, and you discussed many scenarios with her. Yeah.
Some 3-4 cases only, ma'am. Then she joined.
This is not enough. You should find some other study partner. It's not that it is must to pass the exam. There are other ways, like you can find some of your family member or some of your colleague, whoever and your senior or your junior, whoever you find, just request that I want practice with you. And at the end, if you cannot find anyone, just practice in front of the mirror. Yeah, in front of the mirror, and then you can record your own voice, and then listen later on, or just send it to some of the, there are many mentors out there who are correcting your who are giving feedback free of cost. So you can do anyway, even without a study partner, but it is best. What I'm telling you, this is best to have study partner, but even if you don't have, I mean, you can still pass the exam also. It's not a very
How
hard
much
and
time
fast
is it for the preparation, Dr. Samira?
preparation. If you are working, because all of you are working and all of you have family, right? So for the people who are working and who have family, I must say at least 6 months. Yeah, but if you are not like taking care of a family, and or you are not working, for example, then it's okay, 4 months is good. But with everything, I think 6 months. Yes. So yeah.
As far as the knowledge, it is not that much big part of this exam. For what we need all this big time? For what, doctor? Only for practicing?
Now this is a very, very big what do you call it, myth that everyone used to tell me also before I was going for part 3, that knowledge, now you pass your part 2 and you finish your knowledge part, you already have knowledge. Now you need practice only. You need to develop your skill, communication skills, how to handle the instruments, surgical teaching, all these skills, so you need to concentrate only on this. But that is not true at all. So I failed my first attempt of part 3 in UK when I went there to London, because I didn't concentrate on knowledge, and that I had all the skills. I didn't fail in my skill. because I was practicing only the skill and I didn't revise well. There is a different way of revision for part 3, not like part 2, but you need to study your knowledge for part 3 in a different way. But knowledge is that much important that I failed my exam, my first attempt, because I didn't concentrate on this knowledge part. So first of all, you should come out of this that knowledge is not important. I'm going to send you the material that you need to read before each module. So you will know exactly what to read. You still have to read. I'm still reading after I pass my part 3. Believe me, I'm still studying. I'm still reading it. So you have to. Okay. So yeah, it is better if you don't have any idea about the OSCE, it is better to finish like 2 or 3 OSCE books with your study partner, just read it by yourself. There are a few nice books also. I did it with Get Through Tony and Lisa Joy, but there are other good books in the market also. Okay, there will be a mock exam at the end. I already told you. I like this one. When you want to succeed as bad as you want to breathe, then you will be successful. So if it becomes like your like you are breathing, you know. So once something becomes as important as your vital things, then you will do it because you will concentrate on it and you will put all the effort. And sometimes we need to, the people who have passed their part 2, they know very well, all of you have passed your apart from one only, that you need to give up. And all of you have passed important exams. So you know you have to give up many things. Yeah. So we'll do these stations, you know, and who want to do this station? So I have 2 stations. So who will volunteer for this? Let me start my 10. So you know that in part 3 for the exam, let me show you something. I just took a screenshot. I just took a screenshot from the site, from the RCOG website. So I got this date for FAB exam. It is 6 to 10 Feb 2023, and then the May exam will be 8 to 12, and then it will be in November also 6 to 10. And now they are saying that FAB exam is an additional exam and it's not for UK candidates. So the overseas candidates will have a more chance of appearing in this exam. It is for overseas, actually. They are not. Okay. UK are not eligible to sit in this exam, you know. Yes. Now, the candidates, there is one more important information that I found, that candidates sitting the part 3 in November, which many of you have set, are also not eligible to book for a place in FAB exam, as results will not have been issued ahead of the booking window. Let's see what's the booking window. So if you really want to appear in FAB exam, the deadline for all candidates to ensure the address and email addresses and updated is December 2nd. And today is November 26th, right? So it's approaching. If you have to make your mind that you want to appear in FAB or not, or in May, because this is the deadline to ensure the home address and email addresses. Now the assessment or training deadline is it's long before, I think. And the booking window will open on December 8th. Okay, so the booking will start on December 8th, Thursday. It will open, but it will close on December 19th. And on March 7th. So FAB, the exam will be in FAB 6 to 10. And like a month after the exam, the results will be announced, which is fine. I don't know if the people who appeared in November, if they know this information that they cannot sit in FAB in FAB exam 2023, but they can sit in November in May exam. They can apply for May exam, and these are the dates. If you want to go for FAB, then the deadlines are approaching actually, so you have to be very active now. Okay, so this is the information that I want to provide you, and we can start with the scenario, you know. Then I will tell you how first of all we will discuss that this is the scenario and how you are going to prepare the bullet points. First of all, I will give you 2 minutes to prepare the bullet point, and then I will ask you to show me how you wrote your bullet points. So write it like in bullet points, that these are the important issues in this scenario, because we will discuss about it. So these 2 minutes, and then 10 minutes will be given to, like, it will be a role play. Both of them are simulated patient task. So we will do it in 10 minutes, and then after that I'll give you model answer feedback. We'll discuss about it. Sounds good? So who want to do the first station?
I will try, doctor.
Who is this, Anam?
Yeah, doctor.
Okay. No, we can do this one. Are you comfortable with this type of topic?
No, anything.
Okay,
Why
that is very good. I like your
but
confidence.
I want to my MCOG exam. It is mostly practical point, but
Yes.
I'm confusing because I should concentrate on the practical rather than
Yes.
theory. Yeah.
Yeah,
So
but so your knowledge is okay. You just finish one exam. So I'm giving you like starting 2 minutes, okay? And I will mute myself, and this 2 minutes, I want you to write the bullet points. And then later on during the feedback, I will ask you what you have written. So I really want you to write the issues and what you are like in bullet points, exactly what you are going to discuss in this station. So it's a simulated patient task. I'm starting your 2 minutes now. Okay, write your bullet points, please. Once you are done, just tell me, I'll start.
yeah, doctor. Yeah. Okay. Shall we start?
You're okay, that's good. So let me start my 10 minutes. Okay, starting.
Okay. I'm Dr. Anam for today clinic. How can I address your name and age?
Yeah, doctor, I'm Elizabeth Murray, and I'm 20 years old.
How can I address you?
Elizabeth is fine.
Okay. Elizabeth, I know from your paper, that you have an ultrasound today, and you are pregnant. You are pregnant,
Yes.
yeah, and you are pregnant, and now you have ultrasounds with you. and you are now here today to discuss about ultrasound health report. Is it right?
Yes, doctor. Actually, I know the result of the ultrasound, and actually, I'm not happy with the result, and I just cannot cope with it. I do not want to continue with my pregnancy.
Yeah, I understand that, Elizabeth, but is it possible for me to ask you a few questions before we would discuss with your result?
Yes, doctor. Go on.
Okay, so this is your first pregnancy, right?
Yes, doctor.
Is it I mean, spontaneous pregnancy or induced pregnancy?
Doctor, I was not planning for it actually, and it's unplanned. So I'm a student, and I'm in my bachelor program. So I cannot really afford this pregnancy, and especially after I know about the ultrasound, how I'm going to deal with the baby with disability. So I really cannot.
Okay. During this pregnancy, did you do you take any folic acid tab or any medication during this pregnancy?
Not before, because it's not a planned pregnancy, but after, when my midwife asked me to take, I took it after pregnancy.
Okay. So, do you have any medical illness?
No, doctor.
What about your blood group?
It's O positive.
Okay. Do you have any allergies?
No, not as I know.
What about your body mass index?
It is 22, I believe. Yes, 22.
Do you have any surgery before?
No, doctor, I don't have.
Okay. So, what about your pap smear? Is it up to date with the pap smear?
Doctor, I have not yet started my pap smear program.
Sorry, so you are 20 years.
Mhm.
So, shall I ask you one question? Do you have any private question? Do you have any sexual share infection?
No, doctor, no.
Okay, so are you smoking?
Yeah, actually, yes. But I reduced my number of cigarettes per day. I'm like 1 or 2 only per day. Before
Okay.
I was smoking around 10 per day.
Do you drink alcohol?
Occasionally, doctor, on weekend only.
Okay. So do you know about the risk of alcohol on your pregnancy, even if it's a normal pregnancy?
Midwife told me, and I'm trying to decrease it now. I'm trying to stop.
What about recreation drugs?
No, doctor, I don't.
Okay. So with whom are you living?
I'm living with my partner right now.
Okay. Is he supporting?
Yes, he is supportive.
Okay. So do you feel any low mood or depressed in the last few weeks?
Doctor, not actually, since this pregnancy start, I'm not feeling very comfortable, and but anyway, I accepted it, that I want to continue with this pregnancy. But since I know about this ultrasound, I became like really upset.
Okay. So you have an idea about your ultrasounds, right?
Yes, doctor.
Who told you?
My midwife told me, and she sent me to one of the doctor, and but now I'm here. I requested this appointment because I want to discuss something.
Yeah. So about your ultrasounds, there is both baby feet is inverted. I mean, is directed inward.
Uh,
I mean, downward and inward, and it is both sides, not one side.
hmm.
So in such conditions, usually we refer you to the fetal medicine clinic.
Mhm.
So that there is a specialty there who has the facility for further ultrasounds, more detailed ultrasound.
Okay, doctor.
So to see if there is any other congenital abnormality of the baby.
Mhm.
And if they find anything significant, and usually it's both feet, so in such condition, there is possibility for them to do needle test.
Needle test.
Yeah.
What is this, doctor?
Okay, they through a needle they aspirate that fluid surrounding your baby, that water surrounding your baby, will take it and they will send it to the lab.
Okay.
Yeah, for any genetic makeup, for any chromosomal abnormality.
Oh, so it is possible that the baby is not having only this feet problem. It is possible that might be having some chromosome problem or some other defects also.
Yeah, there is a possibility for that. Yeah, correct.
Okay.
So,
Then,
yeah, in such a condition, if there is another anomaly, so your options, whether you want to end this pregnancy, and we are here to help you, or there is possibility to continue the pregnancy, and this is up to you.
yeah. So doctor, in case, even if it is like only this problem, it is possible that there is no other problem, only this is the only problem?
Yeah, it could be a possibility that's only this a problem, and there is certain risk, there is other abnormality also will be there.
Yeah. So if I want to, if I do not want to continue, am I too late? Like, because I'm 20 weeks and the time we will have termination, it will be more advanced. So is that okay?
Yeah, so if there is, I mean, anomaly, usually we have, you can discuss the issue with your boyfriend, and then after that, we have up to 22 weeks. We can do it, and after 22 weeks, we need to inject the baby with certain drugs to make the baby fetal heart stop.
Oh, so I have another 2 weeks, and after that, you need to do some procedure. Okay.
Yeah, that's right. So, and if you decided for termination of a pregnancy, so we can arrange that termination of a pregnancy by after 22 weeks, we give the baby injection. And before that, and even after that, we can start by oral medication, certain tab. You can use it orally. And then after 2 days or less than 2 days, we have another tab, they call it misoprostol.
Okay. Okay, so how long will it take, doctor?
Usually it's depend upon your neck of the womb. If it's, yeah, the neck of the womb, if it's right, if it's well, so it will be easier. But otherwise, even if it's not with this medication, we can repeat the dose of medication. If it's not, we can repeat another course also of medication till you get aborted.
Doctor?
Yeah.
If I want to continue, how you are going to follow up?
Yeah, so if you decided to continue the pregnancy, we refer you to the MDT clinic. It's multiple group of multiple between physicians and between specialized nurse and counselor. The specialty is include that baby doctor, and also the orthopedic doctor, what they called bone doctor, and who did the surgery for the baby for his feet later on.
So doctor, baby will need surgery after the delivery?
Yeah, there is possibility. First, they maybe start physiotherapy for the baby, and there is a special cast they can use it for the baby till after certain age and certain weight gain of the baby. So they will decide to do surgery for both feet.
Yeah. So it is possible that the baby might not need surgery, and with the special boots.
Yeah, it could be according to the type of defect, according to the severity of defect.
Okay. Okay, I got it, doctor. Okay, I'll discuss about it. Maybe I'll discuss with my partner and we'll come back.
Okay, so I will give you patient information leaflet, and we have support group, and next appointment will be with my consultant. Is it
Okay, doctor. Yes, it sounds good.
Okay, thank you.
Okay, so you finished in 10 minutes. So let me stop here. So as I said before, that I'll do like 3 sessions of this, 3 parts. I'm going to send all of you another link. Then we'll do the next scenario.